Hey students, I just wanted to briefly go over some of the information that I posted for you in the GU lecture for, I believe that was week 6. So the first document here that I want to have you see is that this comes from the Washington Department of Health, and there are some laws that you need to be aware of that deal with the care of minors under Washington law. So this is really, really important for you to know so that you can make sure that you understand that, under certain reasons, children under the age of 18 can obtain care all by themselves without their parents. So normally in any state in the union, and this does differ by different states. So for example, this is what's here. When I lived in Texas, I had to learn what the state of Texas considered old enough to seek care for example, for sexually transmitted diseases. So let's just look at the ones that kind of deal with the GU and abortion services. Minor can consent for confidential care, and it says here at any age without consent of a parent, guardian, or the father of the child. Okay, so that's the law right there that they're saying, State versus Kumi, back in 1975. So yes, the minor at any age can consent for confidential care if they want to terminate a pregnancy, and no, the parent, guardian does not need to be it's not need to be there. So parent, guardian consent required. They don't even need to consent to it. And they also do not need to be notified. Okay. Prenatal care. Again, for minors at any age, they can consent for prenatal care without the consent of a parent or guardian. And the same thing here for yes, for that. No, parents do not need to consent to that, and no, the parent and guardian does not need to be notified. Okay. When it comes to sexually transmitted diseases, including HIV care, minors can obtain tests and or treatments for sexually transmitted diseases if they are 14 years of age or older without the consent of a parent or guardian. Okay. In Seattle, King County, will test and treat individuals regardless of age due to the mandate to prevent and control the spread of communicable diseases. So that may be different also in other counties. So you might need to, but you will be okay if the child is 14 and over. Okay. So at least 14 and or older. Okay. No, the parent does not need to be sign consent, and no, the parent does not need to be notified. If they are under 14, if they don't live in Seattle or King County, you probably will need to. Okay, if you want to be. Immunizations. If a child comes in and says, hey, I want the COVID vaccine, and their parent's not there, you cannot give it to them. Okay, because no, unless the minor meets the mature minor doctrine, that means that they are taking care of themselves. Okay, so yes, for immunizations under normal conditions, they will need to have their parent consent unless they are mature minors. Okay, and no, again, usually because they're going to need the consent of the parent, they're going to be notified anyway. Okay. Let me see, what was the other one? Birth control services is another one. Minors may obtain or refuse birth control services at any age without the consent of a parent or guardian. I know some of you are probably sitting there wondering, I did not know this. And you're right. It sometimes comes as a shock to us parents of teenagers that they can do this. And again, I just need to let you know that this does depend on the state. So in this state, at any age, a minor can, walk into clinic, Planned Parenthood, and say, I want to be able to get birth control services, and without the parent consent and without the parent being notified. Let's see. And then the other thing that maybe later on in class, we're going to talk about mental health. I do want to let you know that for substance abuse, treatment, outpatient, also for inpatient mental health treatment, outpatient mental health treatment, minors can receive outpatient mental health treatment if they are at least 13 years of age or older, again, without the consent of a parent or guardian. Okay, parents will not need to be notified without the minor's consent. Okay, so again, you can kind of see this for outpatient. It's a yes if over 13 and no and no. Inpatient mental health, the only thing that changes is that yes, the parents do need to be notified if they're in an inpatient. And let's see, for outpatient substance abuse treatment, it says yes, they can seek care. No, you don't have to get the parent consent. But it says the provider will inform the parents that the minor is receiving outpatient treatment within 7 business days if the minor gives written consent, or if the provider determines that the minor is not capable of making a rational choice to receive the treatment. So that would be kind of like a little asterisk right here under notification of parent. Okay. And then if for inpatient substance abuse treatment, no, the child cannot, self-refer if they're 13. Without the parental consent. However, I think there's a statement here that if DSHS, the Department of Social and Health Services, determines that the patient is a child in need of services, they could, but they need to again notify the parent within 48 hours. Okay. Parental notification is required if parental consent is required. So yes, this would be both. Okay, so I just wanted to kind of cover that briefly for you.